Hello, my name is Dr. Anthony Sestero. I'm a fellowship-trained orthopedic hand surgeon at Northwest Orthopaedic Specialists. I specialize in the treatment of all conditions affecting the hand and wrist. In this video, I'll be discussing distal radius fractures. The wrist is a joint between the forearm and hand. The end of the forearm bones articulate with the smaller carpal bones. There are 8 carpal bones, each with a different shape and function. These carpal bones and their shapes allow for the complex motions that our wrists are able to produce. The forearm bones are the radius and ulna. The end of the radius makes up the majority of the joint surface with which the carpal bones articulate. A distal radius fracture is the most common way to break your wrist. It's also the most common fracture of the entire upper extremity. The distal radius refers to the end of the forearm bone, which is the farthest away from the elbow and closest to the wrist. The fracture typically occurs when someone falls onto an outstretched hand, but can also occur several other ways, such as a car accident. This fracture can be simple or non-displaced, which means that the bone is broken but in its normal position. The fracture is considered more complex or displaced if the bone is not in its normal position, if it breaks into the joint, or if it involves an injury to the other tissues, such as the skin, tendon, or nerve. Symptoms of a distal radius fracture typically include pain, swelling, and tenderness at your wrist. Your wrist and hand may be bruised and appear deformed. Moving the wrist may be difficult or painful. A distal radius fracture can typically be treated without surgery. After a patient is evaluated in the office or emergency room, an X-ray has been taken. We typically have enough information to make this determination. The physical examination and X-rays will help us determine if this is a simple or non-displaced fracture. The non-surgical treatment typically consists of a cast or brace and protection of this limb to allow for healing and preventing displacement. Most frequently, we perform a surgery called an open reduction and internal fixation. With this surgery, an incision is made on the end of the forearm, the bone is realigned, and a plate and screws are secured into the bone to keep it in position. The advantage of this surgery is to achieve a better reduction of the fracture and attain enough security to begin moving the wrist within a week or 2 of surgery. Following an open reduction and internal fixation surgery, the patient is sent home with a well-padded splint that is worn for 8 to 10 days. Pain medication is often necessary for the first 3 to 5 days, and use of the hand is limited to exercises of the fingers. After 8 to 10 days, the splint is removed, X-rays are repeated, and the patient is given a removable splint. The splint is taken off several times per day to work on moving the wrist, but still limiting the use of the hand to light activities. After 6 weeks, the splint will be discontinued and exercises are begun to return to normal activities. The full recovery of normal function can take several months of rehabilitation and healing. Taking care of distal radius fractures is one of the most gratifying surgeries that I perform. Experience and innovation in internal fixation devices has allowed us to achieve greater outcomes for our patients than we could 10 years ago. To learn more about distal radius fractures, please visit our website. Thank you for choosing Northwest Orthopaedic Specialists for your care.